Hi everyone, and welcome to another blog from Living Positively with Interstitial Cystitis. I am Miss Mar, and you can follow me on Twitter at ICPositively. The website is www.livingicpositively.com. Our topic today is Candida, and I'll go into that in just a second. I wanted to make a correction from the blog from the Integrative Conference in New York. I talked about L-arginine and how it decreases nitric oxide in the blood. I was wrong. L-arginine actually increases nitric oxide in the blood. And here's a couple reasons why that might be good for interstitial cystitis patients. L-arginine taken boosts the immune system, reduces inflammation, helps with sleep, and relaxes your arteries to support blood flow and oxygen to and through all parts of your body. Just a couple notes on that. Athletes actually take L-arginine. They want to increase the nitric oxide in their blood because it helps with recovery. So, just note. Also, there was a study that I read in the U.S. National Library of Medicine, circa 2004, I believe, that said that a study done on interstitial cystitis, the patients with ulcers actually had a lower amount of nitric oxide in their system than patients without ulcers. So, again, L-arginine might be a great thing for your IC. On to our main topic, Candida. You ever heard of Candida? I will tell you what it is. Candida is a yeast that lives on your gut, and as long as it's in a symbiotic balance with the other gut flora, it's totally healthy. But an overgrowth of Candida can be a problem. An overgrowth of Candida, I'll give you kind of an example, is let's say my hands are your gut flora. Let's say this is Candida, here's your Candida yeast. And this is the rest of your gut flora, and here's your symbiotic balance to where your body is functioning normally, and you're feeling healthy, etc. When your Candida starts to overgrow and takes up more of a percentage of this connection than the rest of your gut flora, there comes a problem. It's called Candida overgrowth, and I'll go over some of the effects of Candida overgrowth right now, and then I'll tell you how it happens. As I said before, Candida has effects on the body and the brain. Let's go over the body first. Candida affects the body in several ways. Ooh, can't see that because my fingers are in the way. Okay, let's get right there. You see that? Okay. So, Candida, when there's an overgrowth of Candida on your gut, you can see intestinal issues and irritability. You'll have gas, bloating, diarrhea, constipation, indigestion, acid reflux, sometimes a persistent sore throat, thrush, or even rectal itching. So, those are some of the effects on the body. You can also see excessive fatigue, which we have IC, so we always see excessive fatigue, but healing your gut and healing your Candida can reduce these fatigue symptoms. When you crave sugar and alcohol, let's say you have a sweet tooth, or you're just always wanting that extra glass of wine or any sort of alcohol, that is also a sign when your body craves that of an overgrowth of Candida. Acne, eczema, sinus inflammation, which includes persistent cough, chemical sensitivities where you smell something and it affects you negatively, and earaches are also a sign of an overgrowth of Candida. Extreme PMS and low sex drive are also effects of an overgrowth of Candida. And of course, Candida is a yeast, so when you have recurrent yeast infections, that can also be a sign of an overgrowth of Candida. Candida on the brain. Oh, forgot to show you the other side. Candida also affects your brain. Okay? When you have recurring headaches and migraines, when you get brain fog, when it's hard to retain information or even focus, when you get mood swings, which is high anxiety, when you go from hyperactive to depressed, or if you're just irritable all the time, that may be a sign of Candida. If you're dizzy, if you get dizzy spells, and of course, chronic pain, which with IC we have chronic pain. Those are all signs of an overgrowth of Candida. So let's talk about IC and Candida. If you have, I don't want to make you a hypochondriac. Some people have those symptoms that I described, and they don't have an overgrowth of Candida. But because there's no real test of saying, do I have a little bit of overgrowth? Do I have a lot? If you search online, you'll find several sources that say, well, there's a test, but it may say that you don't have an overgrowth of Candida, but you do. I don't want to make you a hypochondriac. So what you can do is you can go ahead and try the diet. You can try the way of life for several months to see if it helps you, because reducing your Candida is healing your gut, and healing your gut is healing your IC. And anything to heal your gut, heal your overgrowth of Candida, will heal your IC. It's my motto, one of my many mottos, but heal your gut, heal your IC. So give it a chance, I guess, is what I'm saying. Let's go over what causes Candida. There are a few causes of Candida. I'm going to give you a couple, maybe I'll give you 4. And just know that there are more causes of Candida, but these are the main ones, okay? The main causes of Candida are a compromised mucosal lining, think of your gag layer, an impaired immune system. Of course, we have IC, we have an impaired immune system. Prolonged or recurrent antibiotic use without probiotic therapy afterward. So if you're just using your whole life, you use antibiotics for this, for that, for this, it can compromise, it can kill that good bacteria on your gut. It can imbalance that symbiotic relationship and allow the yeast to grow over if the good bacteria has died. Lastly, stress. Stress is the big one. Stress affects the body in innumerable ways. It affects your hormones, it affects your sleep, it affects everything. So if you have lots of stress, your immune system is lowered, and so your Candida may be prone to overgrowth. So if you decide that you think you might have Candida, or that the Candida might help your IC, I'm going to give you a website that's going to help you, that helped me. My Aunt Belle, when I first got diagnosed with IC, said, well, in order to relieve some symptoms, we're going to go ahead and go on the Candida diet. She told me all about Candida and the effects. And after I finished the Candida diet, a lot of my IC symptoms, and especially sensitivity, went away. I could eat a lot more things also. So let's start by the diet. You want to go to this website. This is thecandidadiet.com. There's a bunch of links to information about Candida, what it is, the effects of Candida, how you feel after, how you feel before. My aunt helped me, but she was very far away, so we were emailing when she helped me through the Candida diet. So I used this website, thecandidadiet.com, a lot to kind of get me through. So you want to go to that website, and it'll show you the diet. And you're going to want to stick to that diet for a while, and you're going to want to read about it. And there's a couple notes you're going to want to stick to or remember while you're on this diet, if you choose to, because I believe, honestly, that healing your Candida will help your IC feel so much better. Candida is a reoccurring problem. Know this, that if you have a tendency for an overgrowth of Candida, you'll always have that. So every once in a while, you'll just want to flush and redo the Candida diet. But some notes while you're on the diet. You want to stick to it for at least 3 months. While you're on the diet, you're going to want to take a 45 billion culture probiotic minimum, and make sure when you go and wherever you buy it, I would recommend a supplemental store so they know about this, that you get something with a high dose of what we call SAC-B. You'll see it says Saccharomyces boulardii, I believe that's how you say it. But you can just say you need a 45 billion minimum culture probiotic with a high dose of SAC-B in it. You also want to take a yeast fighting enzyme blend. You're going to do this for 3 months. You want 3 different yeast fighting enzyme blends. You want one for 1 month, another for the second month, and a third for the last month. Also, when you see the diet, you're going to see foods on there that are not IC friendly. So make sure you do not eat those foods. You still have IC. You don't just have Candida overgrowth. Also, after you visit the website, there's some things that you will learn about, but I'm going to give you some notes. I want you to definitely research them if you decide to do this. When you are on the website, you can read up about something called die-off, okay? Die-off is when the yeast, the overgrowth of it, is starting to die off and get back to that symbiotic balance. When the yeast dies off, it releases toxins, and they'll make you feel icky for a few days. Believe me, I've experienced it. It's no fun, but afterwards you feel much better. Also, when I was on this one, and from what I've read from other people that have been on the Candida diet, you might lose a lot of weight. Not a lot, I'm thinking like 10 to 15 pounds here. It's just because the diet's so restrictive and your body's going through a lot, and you lose a lot of inflammation. Lastly, make sure that if you start this IC diet, if you choose to do this, that you write down your symptoms from day 1 to day 90 and look over those symptoms. See how you feel, how it's changed. Okay? So that's it. So the reason I guess I brought up Candida was because in the integrative conference, they had talked about people with IC having nail fungus. Candida overgrowth is a main cause for nail fungus, so I just wanted to touch on Candida because I personally went through the Candida diet and felt a lot better afterwards. Like I said, again, my sensitivity to foods was lower, and I could also incorporate more foods into my diet. So that's why I went into it, because when you heal your gut, getting rid of that overgrowth of Candida is healing your gut. You heal your gut, you heal your IC. Your IC is affected directly with your gut health. So, I also hope that you are practicing many stress relieving practices. Did I say practices twice? I apologize. But I hope that you are relieving your stress, whatever it takes. Breathing, exercising, spending time with your kids, spending time with animals, spending time alone. I hope that you really are practicing on your stress, because I believe that stress is a main factor in our IC flares and our IC sensitivity. And, I also wanted to give you an update on me. I'm going to give a shout out to Kristen at healingic.com. I am trying Gotu-Kola. I'm into about a week now. Gotu-Kola, she reminded me that Gotu-Kola can help with IC, and I'm taking notes on that as I go, and I will let you know how that goes after a few weeks of being on it. Also, I'm still on the workout program, which is doing great. I'm feeling stronger every day and seeing differences and being able to bike longer and lift much more. And that's about it. So I want to thank you for watching. I tried to make it short and sweet. I apologize if I talked too fast or said too many ums, but I hope you got something good from it. And I hope that you are doing well. I hope that you are not in a flare, and I hope that you are relieving your stress, and have a wonderful weekend. Bye-bye.